Do you suffer from the debilitating symptoms of chronic pain, swelling, and loss of joint motion due to arthritis? Are you taking drugs like Celebrex and Vioxx or other super aspirin prescriptions? If you are, you're increasing the risk of heart attack and stroke by up to 50%. This is Dr. Tom Roselle, host of Dr. Tom Roselle Live Sundays at 12 noon. Why live with pain or the dangerous side effects of drugs when the doctors at the Roselle Center for Healing, practicing 21st century integrative medicine, can help you experience relief like never before? Simple, safe, chiropractic, acupuncture, and nutritional care can provide significant relief from arthritic pain in less than 6 weeks. More than 70% of our patients experience a return to life far beyond their expectations. Give yourself the best gift possible, freedom from arthritic pain, naturally. Call today to schedule an appointment. Call 703-698-7117 or visit online at rosellecare.com.
Dr. Tom Roselle Live, right now, on 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle, bringing you a very special and important program today, one that unfortunately affects way too many people, one that most people don't know where it comes from, and in my opinion often pays for mortgages from some very well-meaning surgeons because they don't know the other way of coming around the back end and getting it fixed. We're here to bring you the most intimate information, and perhaps you've had a problem, as you know, we've told you about over the years, and you've tried, you've applied, you've done the same old, and nothing's worked really well. Well, here's one of those examples that we want to help you with. What am I talking about? I'm talking about carpal tunnel syndrome. It's a repetitive stress pattern. It's something that affects both of your hands. You can get numbness, tingling, pain, all kinds of symptoms. You drop things, and sometimes that's the only symptomological presentation, that you reach for something, you can't hold on to it, or you can't turn a doorknob the way you're supposed to, but then all of a sudden you notice that it's going into your arms and your shoulders, and all of a sudden you got a stiff neck too, or you have neck pain that's chronic, and then it happens the other way around and your hands go bad. Anyway, in studio, and to discuss this thoroughly, someone who is a specialist in the area, someone who you've heard many times on Dr. Tom Roselle Live, and many of you have had the pleasure and the opportunity of having him treat you, Dr. Leonard Poe. Dr. Poe.
Good morning.
Close.
Yeah.
It's almost afternoon. I mean, it actually is afternoon. You know, we have this program at 12 noon, and we never know whether it's morning or afternoon, and I do that constantly. But since it's a little bit after the 12 o'clock hour, it is afternoon.
Okay.
Okay, so now that we have that cleared up.
Good afternoon.
Good afternoon. Anyway, we're going to talk about, and I know you're going to do the in-house continuing education program this Wednesday evening, August the 5th, 7:30 p.m. at the Roselle Center for Healing. It's on carpal tunnel. It's on something that affects literally millions of people, and sometimes they're not aware of the problematic day-to-day initiators of this thing. That's what we want to talk about a little bit today, as well as the fix. But this Wednesday evening, 7:30 p.m. at the center, and we're going to ask you to be our guests, as we always try to host you with the most important information that can change your lives. Here's what I want to talk about first. Tell me about, and tell our audience about, the, if you will, I'll call it a pandemic, almost an epidemic, but not quite. But how many people does this affect? You know, on an ongoing basis. Are we talking about hundreds of thousands? Or are we talking about millions of people?
Millions of people.
And, you know, it happens to, you know, folks across the board. What are the folks out there that have to be aware of this? Is it just anybody, or are we in particular situations?
Well, no, I mean, it can be anybody, but particularly people that use their hands a lot. I mean, the first thing you got to really ask with this is it really carpal tunnel?
So you're suggesting that you can have hand pain, and it's not carpal tunnel syndrome?
Yes.
Okay, so
and I'm sure you've seen that a lot over the years as well.
Yeah, but this is your show.
Yeah. Oh, it's my show now.
So it's up to you.
That just made today real interesting.
That's right. So it's up to you. No, you're not interviewing me. So it's up to you to lift the veil, if you will, so to speak. So seriously, all kidding aside.
One of the things that we tend to do, and I say we as lay people, is that anytime we have hand pain, we immediately call it carpal tunnel. And carpal tunnel is a very particular diagnosis. It's entrapment of the median nerve at the wrist. You can get the same presentation, though, and it can be entrapment of that nerve lots of other places. It's a tortuous route from the neck all the way to the fingertips. And
we talk about the median nerve. We're talking about the middle nerve of 3 that go into the hand. Is that correct?
This is my show.
Okay, but I have to distinguish it for our audience because,
Yes,
you speak in big words, paleface, and, we have to make sure that we distinguish these things.
Yes, we do.
Okay. So let's go on. Carpal tunnel.
But as you just said, it's one of three nerves. And often you can have pain in other parts of the hand. We have a tendency to want to call it carpal tunnel, but it's not really carpal tunnel. That's affecting a different nerve. So the first thing, the most important thing, is to really distinguish, is this carpal tunnel, or is this another nerve entrapment, or is it something else entirely?
So patient comes in and says, Doc, my hand or my hands, they can be both sides. I get numbness, I get tingling, it hurts, it aches, it throbs. How do you start opening that puzzle up and distinguishing which is which? And
the first thing, is it one hand or both hands? Because if it's both hands, it's probably not coming from the wrist. I would just play the odds on that. It's probably coming somewhere a little bit further up where those nerves meet.
So in other words, we can have a carpal tunnel-like presentation, and it has nothing to do with the hands.
It has nothing to do with the hands whatsoever.
But they went to the orthopedist and the neurologist said, you've got bilateral carpal tunnel. So we got an issue.
And that happens a lot.
It does happen a lot. And, interesting, and I'm going to make
But if you want to go ahead and get the wrist cut,
yes. Well,
it's not coming back afterwards.
Look, the thing is, the patient comes in that I had carpal tunnel in my right hand, I had surgery, and then I got it in my left hand. It's not contagious.
No.
And that's the thing that we need to talk about. It's not something that all of a sudden attacks the other like a virus or bacterium. This is a mechanical problem. But as you said earlier, it can start upstream.
Yes.
So let's talk about the anatomy. I think that's the most important thing that people really need to understand.
Hey, I would agree with
you. Right?
That's unusual.
I know. How did that happen? This Wednesday evening, Dr. Leonard Poe will be your host, your presenter at the Roselle Center for Healing, talking about this enigma, this carpal tunnel pattern. Let's say that for a while. But it can be hand pain that is not a true carpal tunnel. It presents that way. It can be other things. But if you really have had any kind of problems with your hands, any tingling, any numbness, this is an opportunity really for you to find out not only what it really is, but more importantly, that you can get it fixed without surgical intervention.
Oh, sure, yeah. This one you can resolve, and this is nothing mystical, nothing strange. This is straightforward biomechanics. It's not hard.
So let's talk about it. Let's talk about the anatomy behind this thing. We've played with it a little bit up until this point, but for our listeners' benefit, let's talk about how this distribution takes place and where it comes from. And this contagious right to left really is not a right to left situation. So explain, please.
No, and when you see it, when it's in both hands or when it goes, sometimes it's in my right, sometimes it's in the left, that's when, like you said, you want to go back upstream. And the nerves all start from, that we're talking about here, start from the cervical spine. They start from the neck. And when you see that pattern going back and forth, you really need to start thinking about what's going on in that neck, in that cervical region. Do you have a lot of muscle tightness and tonicity? Do you have what we call subluxations? Do you have changes to the posture of the cervical spine? Today I'm leaning a little bit to the left, and I get on the left side. Today I lean a little bit to the right, and I get it more on the right side. So it can start back there, but when that nerve leaves and it goes out the neck, through the shoulder, down the arm, through the elbow, down the forearm, and through the wrist, there's lots of places where it can start to get pinched, where it can start to get irritated. So you've got to look at all those different places to see, where is that nerve? Where is that happening to that nerve?
I tell people to sit there and, particularly if they have these kind of problems, to open up their palms in front of them, palms up towards their face. And their thumb in the middle and half of their index finger is that fifth nerve that you're talking about, that median nerve. That's the one that, if it's a problem, is a carpal tunnel. The thumb hurts, the pad of the thumb hurts, the index finger hurts, and it's coming from these 8 little bones in the middle of the wrist that has, in the center of that, in the middle portion of your wrist, has a groove, and that's the tunnel.
That's the tunnel.
And because those bones are called the carpus, it's called the carpal tunnel. So these bones move, and they affect the carpal, or the median nerve, but as you said, there's 3 nerves in there, and there could be any of them. But it can start in the neck first, because that nerve originates in the neck.
It can start in the neck. It can start right there in the vertebra in the neck. Okay, if the holes that we call the foramen, if those are being occluded either by other bone, by disc, by whatever, It can start there. It can start in the neck muscles. It can start in the shoulder. It can all the way down. There's lots of places. It's a very torturous route to get there, and it can happen anywhere along that way.
You know, so many people come into the office and say that I had surgery, I had an injection. They do steroids injections. They said take these drugs, and nothing's worked. It numbs it for a while. It makes it better for a short time, but they still have loss of function, and then the pain comes back anyway. Mm-hmm. And very few true carpal tunnel surgical interventions are long-term successful,
right,
simply because of the fact that what they've accomplished, one, they've decompressed the nerve so there's no nerve pain, but now they've made the wrist more unstable because they've cut the band, the sheath that binds those things together.
Yeah.
That's right.
And then you start getting all sorts of other problems in the forearm and wrist and everything else. Yeah.
Yeah, it's an unfortunate cascade of mechanical breakdown, and you know, it's something that, you know, we often see these people as a last resort, and in a unfortunate situation for them, it's a good news and bad news. The good news, we can fix it. The bad news is they should have been here a long time ago. And that's what we're trying to do. We're trying to save, you know, people who are listening to us from surgical intervention when it's not necessary, in our opinion. There's a few because of very specific traumatic injury that you really don't have a choice, but we're talking about a very small percentage. This Wednesday evening, Dr. Leonard Poe will be your guest, your host, your presenter, your affable human being that will take you through this thing at the Roselle Center for Healing in Fairfax at 7:30 p.m. What we'd like you to do is call our office at 703-698-7117. That's 703-698-7117. Tell my staff you'd like to be there. As always, these is a gift to you. They are in-house programs we do every other week on different topics, and it's an open house. Please join us. The only thing that we do require is a reservation. So call our office, 703-698-7117. Tell my staff you'd like to be there, and give them a number where they can confirm, because once we're out of space, and there's no room for you. You're going to have to sit on the floor, and, you know, it's summertime. You don't want to do that, so make sure that you call. Let's get into it just a little deeper into the process with this hand pain. Let's shift it a little bit, just from carpal tunnel with the median nerve involvement, going into the thumb and the index finger, into this weakness of the hand and loss of strength, and sometimes just pain throughout the whole area. So a patient comes in and says, you know, I'm having all kinds of problems. I wake up in the middle of the night. I have to shake and move my hand around. And so what distinguishing features do we have to go through and talk about at that point to figure out, is it the wrist? Is it the elbow? Is it the shoulder? Is it the neck? Where do you go from there?
Well, that's called the exam.
I get that. I'm asking you to explain to them.
Yeah, that's when, we do, part of what we do is a lot of muscle function testing, which muscles are working, which muscles aren't. That's a lot of what we do with applied kinesiology. Some simple orthopedic tests. I mean, there's dozens of different ways to test this. Just, we don't have to have an MRI necessarily. Good old-fashioned physical examination will tell you where that nerve problem is coming from, and you can start to isolate it. And then you figure out where you need to fix it.
You know, when you're dealing with a patient with hand pain, it can be so disruptive to their lives, and the cost
that's an important joint.
No kidding.
That's a big one. That's probably, evolutionary standpoint, probably the most important joint we have.
Yeah, if you don't have a thumb that works in opposition to each other, you can't be human.
That's the tough one, yeah. So when that one's, and that's the problem too, why we talk about it being repetitive stress injury, and it's a chronic problem, because we use our hands a lot.
And everything that you can think of.
Hands and ribs. They get worked all the time.
That's right. You go to pick something up, you have to have your thumb in approximation. Some people can do it with their two fingers, but it doesn't work quite as well like chopsticks. But you have to have that approximate apposition to be able to do virtually anything, to hold a pen, to write, so forth. For most of us, it is exponentially difficult to function without it.
It is.
And we end up, not being able to do what we do in our life.
That's why we get panicked about it. That's why we're rushed sometimes to do treatments that may not be the best thing for it.
No, and we want the quick way out too often.
Right.
It hurts. So you go in to see the doc, and what does he do? He injects
a shot.
Injects a steroid into it. Now you've got a problem that's going to cascade. What the injection of the steroid does, the cortisone will decrease inflammation. It decreases the swelling. It does that. But it doesn't solve the problem that is causing the inflammatory response to begin with. So if you've studied any kind of sports injury, what you see is that when you inject a steroid into the joint And if you do it a couple times, the joint actually will begin to degenerate.
Right.
Now you've got a destructive degeneration of the joint space.
That's why you're limited to how many you can do.
That's right. And they may give prednisone, they may give all of those things. It's not okay. We're going to get into this in a more intimate...
Yeah, there is a little biochemical piece there that
there
we'll
is,
talk about.
And we're going to talk about that. We're going to take this apart a little bit more, but we're coming up for a break. We have to pay homage to the people who are bringing you Dr. Tom Roselle Live. Stay tuned. Don't go away. We'll be right back.
This is Dr. Tom Roselle Live on 105.9 FM and AM 630 WMAL.
You've been everywhere, you've done everything, and you still feel like, well, you know. Did you know that your health and wellness starts with your brain and nervous system? What if by establishing normal brain and nervous system function, you could regain your energy, strength, and vitality? Would you be interested? I'm Dr. Tom Roselle, host of Dr. Tom Roselle Live. Join me and an elite group of wellness practitioners for Ageless Health 2015 on October 17th at Fairview Park Marriott Hotel in Falls Church, Virginia, for a day that could change your life forever. A day when you'll learn step by step how to create a brain-body connection that will allow you to live in a state of wellness that you deserve. Register today at agelesshealth2015.com. That's agelesshealth2015.com. Or call 703-698-7117. Register today. After all, your health is a do-it-yourself program. Welcome back, everybody. Dr. Tom Roselle here. We're talking about carpal tunnel today, a very important presentation. Hands go numb, fingers get tingly, but we're trying to distinguish what really happens in your hands because it's not always a true carpal tunnel presentation. As we said, carpal tunnel is really one nerve root. It's called the median nerve as it goes into your hand, and it goes to innervates your thumb and your pointer finger, your index finger, and then you have other nerves. You have something called the ulnar nerve, and that takes your little finger and the ring finger on your hands on either side, and then you have the radius nerve, and that takes the rest of the hand in distribution. So whether you're dropping things, whether you have pain, you wake up in the middle of the night, you have to shake your hands suffer the consequences of both numbness, inability, and loss of function. This is an important program for you. You can really learn how to change this and not have to live the rest of your life this way. The longer you go, the longer you get steroid injections and you take different medications, then you end up with true degenerative disease, degenerative change that could have been prevented and taken care of early on. Love to have you as our guest this Wednesday evening, 7:30 p.m. at the Roselle Center for Healing. Still light out, so join us. 703-698-7117. That's 703-698-7117. That's how you make reservations for this Wednesday's program and presentation. These are always our gift to you. It's our gift to the community. It's the way we know that we can help you help yourself. It's a critical situation in today's world that you don't know. You're being told, you're being sold bylines, and you're saying you have to have. You never have to have anything. If you catch it early enough, you can change almost anything. Dr. Leonard Poe's in studio with me. We're talking about this very fascinating and interesting situation. It has to do with the nervous system. And by the way, before we get into it, speaking of the nervous system, coming up October the 17th, Ageless Health 2015, and we're going to be talking about the brain-body phenomena, everything that is connected from above down. And my entire staff will be there, and you'll be able to listen to some great presentations. Dr. Poe will be there to talk to you and to consult with you. So join us. We'd like you to go to Ageless Health 2015. Don't waste any time because as every year we maximize our presentation, our seating capacity. So go to agelesshealth2015.com and register today. This is a day that goes all day long. We have multiple presentations. You get to see some vendors. You get to be shown how to do core training exercise and some martial art presentation, Tai Chi. And then at the end of the day, what we do is wrap it all up for you, and we show you how to put it together. It's an important presentation. We do it every year. We do it for you. We want you there. Dr. Poe, let's talk about this ongoing nastiness in our hands, those things that we wake up at night, we shake our hands. So here's a question that we get asked in the office on a regular basis. Person wakes up in the middle of the night, their hands are numb. They roll over, they turn over, they shake their hands, or they move their arms around, they change positions, and it goes away. You ask them, do you have the problem during the daytime? Not always.
Blood sugar.
Good job. Good job. I'm proud of you. Go ahead and talk about it a little bit.
Yeah, I remember when I taught that to you.
You did.
No, I think actually...
I'm giving you a lot of rope today.
I think actually I heard that first through maybe 4 years ago, I think, at an ICAK conference that we just finished up with.
Yeah, she did.
So that's it's a neat little thing. The time at night that we're talking about is a time at night in the acupuncture system for the liver meridian. And some of the chest muscles, we'll make this layman, some of the chest muscles correlate with that particular acupuncture meridian, the liver meridian. And if you're getting feedback in those muscles at night, they'll pinch off and they'll choke some of those nerve roots as they're coming out of the shoulder underneath the clavicle and put your hand to sleep. Yep. And that's because in the middle of the night there, you're running out of blood sugar. It's dipped down too low, and the liver's got to kick in, and it's got to start making blood sugar for you.
Good job.
I'm
very proud of you. Good. Yeah, that's exactly what it was. I was wondering
because I'm auditory and I remember things.
Yes, you do. So anyway,
I didn't read it anywhere.
No. As Dr. Poe was saying, there's in our job, in the world that we live in, relative to our specialty, applied kinesiology, we observe and respect a relationship between organs and muscles. And every organ and muscle has a nerve. It has an acupuncture energetic. It has blood supply and lymphatic system, all those things that they share cooperatively. This muscle is your chest muscle. It's the pectoralis muscle, and it relates to liver function. And the liver energy is at high point between 1 and 3 o'clock in the morning. So when the liver energy gets high, at that time of the night, you're going to have to basically suffer the consequences of the symptoms that are associated with that. And the chest muscle is one of those things that will then get too strong, closing off the nerves that go into your arms. And so what you have to do is you have to change positions to free the nerve up, and then you get through that period of time. So the fix is... Or
you can have some protein before you go to bed.
Yes, you can. About an hour before, half hour, actually right up into bedtime, eat about an ounce to 2 ounces of piece of chicken, a few nuts.
Yeah, just a little bit of protein.
You don't need a lot. That will balance it. And by the way, you will sleep through the night. You won't wake up repetitive.
You'll wake up better in the morning.
Much better in the morning.
Much better in the morning.
It's the old thing, don't eat too late. It doesn't carry all the weight that they try to tell you that it does.
Depends on you're eating throughout the day, too.
Yeah, that's it. I mean, most people skip meals and they eat garbage. But anyway, that's
one of those neat little things in our profession and in what we do with applied kinesiology that it's just a really neat little thing you can figure out for the patient relatively easily, but it makes a profound difference. It makes a really big difference
very quickly. The other day I was up at a clinic in Maryland, and we were looking at this integrative care clinic up there, and I met with the principals, and they're both physicians, and supposedly they have many different specialties within it, but they don't integrate like we do. They don't look at it. So I've known these people for quite some time, and the one doctor had a carpal tunnel brace on. And so we get to talking. I just went up and I said, "What's that?" And I was told, that this person has had a problem for the last couple of months. And I said, "Can I treat you?" And both eyes kind of bugged out of this doctor's head. And I said, "Take it off." So we took off the brace. I checked it. So what I did is I took the thumb and the little finger and I approximated it and put some pressure on it. And the doctor couldn't hold the thumb and the little finger together. And then what I did is I had this doctor turn their head to one side with just a little bit of bending, and I retested the muscle. At that point, all the pain was gone, and there was total normal strength. And this doctor looked at me and said, "What did you do?" I said, "Your carpal tunnel is not a carpal tunnel. It is a neck problem." And I said, "Would you allow me to treat you?" This doctor looked at me and said, "Yes," mostly because there was no option, and there were other people watching. So what I did is I did a very straight-up chiropractic adjustment in a sitting position, worked the muscles of the neck and shoulder, and then in a neutral position, I rechecked everything. And all the pain, all the strength loss that was there was gone. It was back to neutral. And I said, "Look, this is probably not going to hold because you have to be treated repetitively." I said, "You have doctors in this office that can do what needs to be done, but you have to treat it cooperatively and long enough so it stabilizes. But this is, we're talking about, and the reason I brought this up is these are good people. These are people who care, and they look at the integrative model as an independent, everybody's there under one shop, but they're not looking at it in a system approach of multiple professionals doing certain things, right? So you have to look at it systemically. You have to look at the history, like you were bringing out. It has to be very smart evaluation to be able to determine the treatment.
You have to look at the nutritional patterns, the biochemistry, the energetics, because it all plays a role.
There's one piece that a lot of people miss as well, and when we talk about this right now, people are going to say, what? How could that be? And there is a visceral, an organic presentation other than blood sugar handling that can cause swelling of the wrist and cause this carpal tunnel-like or actually hand numbness to occur. So for a toss-up question for $3.26, let's see if you can hit this one again.
It's really hard. Could you bump it up a little bit?
Yes, I know.
It's the ileocecal valve.
Good job. You're 2 for 2. This is a great day today.
I know.
Okay. The ileocecal valve is, and people say, what's that? That's the area of your small intestine, large intestine hookup. And that's where we call it a valve, and it's not really a valve. It's 3 muscular rings that allow food once digested from the small intestine to go into large intestine. But what happens is that valve becomes irritated because of the garbage we put in our system. The hot, spicy foods, the things that we don't chew up really well, all that stuff.
It says, get it out of here.
That's right. It wants it gone yesterday. But it causes an enhanced irritation of that joint space. And interesting presentation is in the wrist.
Right. And that's where you got to look at somebody's diet. Is it garbage or are they eating pretty good?
Yeah, people come in and say, well, I don't want to change whatever. And it's, when they have that attitude, they get stuck into that chronic loop. Things don't go away. But that ileocecal valve, for years by many alternative functional practitioners, was called the great mimic. And the reason for that is because it can produce so many other symptom-like representations. And if you already have a problem that you're putting up with, now that inflammatory reaction that's due to that valve will make that thing that you've been putting up with far more severe and far worse than it could possibly ever be.
So many things come back to the gut anyway.
Most everything.
I mean, just about, yeah.
That's where your immune system is.
Mm-hmm.
And we're talking about carpal tunnel. How does it go to the gut?
I know. It's so weird, isn't it?
It's awful. 703-698-7117. That's 703-698-7117. That's how you call to register for this Wednesday evening's program on hand pain. Carpal tunnel syndrome, numbness, tingling, all the things that are there. You've been putting up with it for way too long, all these repetitive stress injuries. Sometimes it's just a loss of function. You don't have the strength in your hands that you used to, or your hands you were told that they're arthritic, and you have to put up with it. And it's not necessarily so, my friends, and this is an opportunity. Give our office a call. Love to have you as our guest. Dr. Poe will go through step-by-step the intimacies of everything that you need to know about and what you can do to make a difference. If you've got braces on your hands that you have to sleep with at nighttime because they're tingling and numb, don't put up with it. It's not okay. You need to get your life back and restored because there's a way of doing that. And to neglect it, to be sold a bill of goods, so to speak, is awful. Shame on them, and shame on everybody who believes the story without doing further investigation. Let's talk a little bit about that phenomena again. And what I want to go back to is people that have these patterns, and they go for surgery. And what the surgery does, by the way, and carpal tunnel surgery is very simple. Mm-hmm. What they do is they cut your wrist up to about just beyond your thumb pad, and then they slice this sheath. Why did they do that? What's the whole purpose in this type of surgery?
That sheath is there to hold. It creates a ring to hold the carpal bones in place, to hold the radius in place, the forearm bones in place, and creates that tunnel that feeds, your arteries, veins, nerves, everything through it. And so the idea is that, this must be too tight. Let's go ahead and cut that and release it to create more space.
And they don't do anything else?
No. Well, the injections beforehand.
Oh, that's right. That's right. They have to do the steroids. That's standard of care. You have to do the medication, the injections, and then the surgery after the fact. Yeah. By that point, they loosen it up and they cut it, and then they tell you go about your way. Blessings, from your Creator, and everything works.
Good luck.
Good luck. It's not the way it's supposed to work, my friends. It's that sheath that's in there was there for a purpose. You weren't created with spare parts or parts that weren't supposed to be in place. And there's a reason these things. And let's go to this, because this, as we're talking about it, I don't want to steal too much from your show, because I know you're going to do a lot of that, this Wednesday evening. But when you're talking about these wrappers, this sheath that we have around the wrist, and other parts of the body have them as well. They're technically they're called retinacula. But it's just a hard fiber sheet.
The whole thing's in place.
That's right. That's all it means, right? And it's like plastic wrap.
Right.
And it's tight. It's a heavy band, and so forth.
Because things are supposed to be held in place there.
But when we see these bands, these fascial wrappers get tight, there's often a reason that occurs.
Yes, it is.
And sometimes it's nutritional.
Well, and that's where we got to talk about a little bit about the biochemical side, because that's a whole other hour.
It is, and we're coming up to about 20 seconds before we have to take a break. But we'll touch on it quickly, and we'll tell our listeners that they really want to know about that biochemical piece.
Because that's a big piece.
This Wednesday evening.
And for like the 5 other things you have going on wrong with you? Yeah.
7:30. You're listening to Dr. Tom Roselle Live. My guest in studio, Dr. Leonard Poe, your host and presenter this Wednesday evening. We'll be right back. Don't go away. This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a Do-It-Yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Dr. Tom Roselle Live continues now on WMAL.
Welcome back, everybody. This is Dr. Tom Roselle. You've been listening to Dr. Tom Roselle Live. We're in studio. My guest, your host this Wednesday evening, Dr. Leonard Poe. Your presentation at our studio or at our office this Wednesday will be on hand pain, carpal tunnel syndrome, as it's affectionately called. But if you've been listening to the program today, you realize that it really might not be carpal tunnel. That can be a biochemical, can be dietary, can be something other than that that's causing the problem. And steroid injections and surgery don't cut it. There's other ways of handling this. Is a straight up biochemical and neurological pattern that if you identify properly. Every Sunday we bring you the most intimate and updated information on integrative and natural therapeutics. Our job is to provoke you. My job, if successful, is getting you to understand that your health is in your hands, that you have the opportunity to make choices and turn things around. To ignore that and to put it in somebody else's hand and let them do whatever they're going to do to you without questioning that, you have to be an educated patient. You have to understand that the body was designed to fix itself under the right conditions, and this is one of those things. We'd love to have you as our guest this Wednesday evening at the Roselle Center for Healing in Fairfax. All you have to do is give us a call at 703-698-7117, 703-698-7117. Dr. Poe, we have a couple minutes left, and we touched a little bit about there is a biochemical piece that's associated with this, as we said, the retinacula, the wrapper around the wrist that they cut in surgery, that causes it to not work properly.
Right.
What are we talking about?
We got like a minute and a half left.
Something like that.
Yeah. I think you're gonna have to come to the show on Wednesday.
You're tough.
Yeah.
Yeah. It's one of the B complexes.
It's a big comp. It's but it's more than just.
It is.
It's more than just the B's. That's a big piece. And if we do it now, it's just gonna. So we're gonna tease you a little bit.
Okay.
And if you want to understand some of those nutritional pieces, some of those biochemical pieces, come on out Wednesday.
You got to be there. So we'll tell you that it's a B complex problem. We'll tell you that it has to have something else to bind it to transport it in. We'll tell you that it often causes a very specific type of anemia as well, and that can be part of the hand pain that you're getting if it's not there. It can cause, if it's not there, it can cause your blood vessels not your blood vessels, but your blood cells not to produce adequate amounts to be able to transport oxygen. Subsequently, you can't heal. So,
and you have lots of other problems on top of carpal tunnel.
Yes, and
like most people.
Most people. And one of the primary presentations when this thing is not there, along with one other B complex problem, because we're talking about the ileocecal valve, is swelling and tingling that doesn't go away. And it also can affect your feet. And you can have something called a tarsal tunnel syndrome, which is the same thing in your ankles and your feet that is in your hands and your fingers.
Yeah.
So this Wednesday evening...
That's why it's the whole person.
I know. And you have to look at it. This truly is the biochemical structural piece. This Wednesday evening, Dr. Leonard Poe will be your presenter, your host, at the Roselle Center for Healing in Fairfax. Join us and really find out how you can get rid of this thing. We're playing, we're kidding, and so forth, but it's a very, very serious condition. We want you there. We want to be able to help you. See you Wednesday night. This is Dr. Tom Roselle. Bye.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.